Hey everyone, this is Dr. Marcon, and we are going to go over part 2 of chapter 1, the human body and orientation. So this is the part of the chapter where we go over our anatomical terms. So first we'll talk about anatomical position. So standard anatomical position is person will be standing up, body is erect. Feet are slightly apart, about shoulder length apart. We have our palms facing forward with thumbs pointing away from the body. So all the directional terms that we speak about, that we talk about, are in relation to a person being in anatomical position. So our directional terms will describe one body structure in relation to another body structure. And direction is always based on standard anatomical position. So we use anatomical position for our reference. Right and left refer to the body being viewed. Okay, so it's the right and left of the person or the patient, not the right and left of you as the observer. Okay, so right and left of the body being viewed of the patient. So here is a table in your book, table 1.1, that describes orientation and directional terms. The first term that we're going to talk about is superior. Now, another term for superior we can use is cranial, cranial meaning towards the head. Another term that we often use is cephalic, cephalic also meaning towards the head. So the definition of superior is toward the head end or upper part of a structure of the body. Also, you can define it as meaning above. So an example of this would be the head is superior to the abdomen. Now, opposite to superior, we have inferior. A term that we can use that means the same as inferior is caudal, or caudal means toward the tail. So during our embryological fetal development, at some point we did have a rudimentary tail, which eventually becomes part of the body. So of course, we don't walk around having tails, but caudal is the term that means toward the tail. That is also synonymous with inferior. So defining inferior or caudal, it means away from the head end or toward the lower part of a structure of the body, also below. So an example of this, the navel, that contains the umbilicus, is inferior to the chin. Our next set of directional terms, we have anterior. Now, another term that we can use for anterior is ventral. Okay, so this means toward or at the front of the body, or in front of. Okay, so an example of this would be the breastbone is anterior to the spine. Opposite to anterior, we have posterior. Now, posterior, another term for posterior is dorsal, meaning towards the back. Again, think of the dorsal fin of a dolphin. So, definition of posterior means toward or at the back of the body, also means behind. An example of this would be the heart is posterior to the breastbone. Now, note that in human terms, ventral and anterior are synonymous. But this is not the case in four-legged animals. Luckily, this is not the anatomy of animals. This is human anatomy. But in four-legged animals, anterior actually refers to the leading portion of the body. So in humans, that would be the abdominal surface. In a cat, for example, it would be the head. So the head of a cat is actually anterior. However, ventral, when we're talking about animals, means belly, refers to the belly of a vertebrate animal. So it is the inferior surface of a four-legged animal. Okay, so likewise, dorsal and posterior surfaces are the same in humans. However, in animals, dorsal refers specifically to an animal's back. So, like I said, dorsal of a dolphin, dorsal of a shark. So However, the dorsal surface of four-legged animals is actually the more superior surface. If you actually see, a four-legged animal standing on its four legs, we know that the dorsal surface is actually more superior. Okay, so human directional terms might not be the same as animal directional terms, but fortunate for us, we are just focusing on human anatomy and human directional terms. And the next set of directional terms that we'll talk about include medial and lateral. Okay, so if you have a line that divides the body into right and left, we call this the midline of the body. So medial refers to going towards or at the midline of the body on the inner side of. So an example of this, the heart is more medial compared to the arm. So the heart is more going towards the midline of the body compared to the arm. Opposite of medial, we have lateral. Lateral being defined as being away from the midline of the body or to the outer side of the body. So for example, the arms are more lateral to the chest, okay, being away from that midline. Now, intermediate is actually between a more medial and a more lateral structure. Okay, so an example of this, the collarbone is intermediate between the breastbone and the shoulder. The next set of terms we have include proximal and distal. So proximal, when we talk about proximal and distal, we talk about points of attachments or points of reference. So proximal means closer to the origin of the body part or closer to the point of attachment of a limb to the body trunk. So if we're looking at the upper limb, for example, we know that in reference to the point of attachment of the upper limb, the elbow would be more proximal compared to the wrist. Okay. Opposite of proximal, we have distal. Distal meaning farther from the origin of a body part or the point of attachment of a limb to the body trunk. So an example of this would be in the lower limb, the knee is more distal to the thigh when we talk about the lower limb being its point of attachment at the hip. Okay, so the knee would be more distal to the thigh. Other terms that we use, we have superficial. Another term that we can use for superficial is external. So superficial, as its name implies, means toward or at the body surface. So we know in this example, the skin is more superficial to the skeletal muscles. Whereas deep means internal or away from the body surface. We know that the lungs are deep compared to the skin. Okay, so those are some very important directional terms that you guys do need to know. So now we're going to talk about regional terms. We know that the body can be divided into regions. We have two major regional divisions of the body. We have the axial region, which includes the head, the neck, and the trunk. And then we have the appendicular regions. So these include the limbs, both upper and lower limbs. These are the regions that basically attach to the axial region. So regional terms designate specific areas within body divisions. So here is a diagram in your book, figure 1.8a, that shows you the regional terms used to designate specific body areas. So as you can see, under the cephalic region, we have frontal, orbital, nasal, buccal, oral, and mental. So all of these are within the cephalic region. We have the neck region, also known as the cervical region. And then we have the thoracic region, which is our chest. That includes the sternal, the axillary, and the mammary areas within the thoracic region. Okay. Also part of the axial region, we have the abdominal region. And we know that our abdominal organs are within that abdominal region. And here we have our umbilical area or umbilical region within the abdominal region where our umbilicus is, our belly button. Also located within the axial region, we have the pelvic region that includes our inguinal area or groin, as well as the pubic or genital region that includes some of our external reproductive organs. So all of those are part of our axial region. We then also have our appendicular regions that include areas within the upper and lower limb, as well as our hand and our foot. So all areas within the appendicular region, these attach to the axial region, okay? So if we look at the posterior aspect of the body, we still have specific areas within the regions that you guys can read about. We have, of course, within the axial region, posterior to the cephalic region, we have the otic and occipital area, meaning towards the back of the head. Again, here's the posterior cervical region. And then in our dorsum or back, we have the scapular area or scapular region that includes the scapula, vertebral area or region that is within the dorsum, as well as the lumbar and the sacral, so making up the lower portions of the back. And then we have our gluteal regions. That includes our gluteal muscles, and then the perineal area between the anus and the external genitalia. So all part of the axial region posteriorly. And then we have the posterior areas within the appendicular regions. So for example, in the upper limb, we have the acromial area that includes the acromion of the scapula, and then we have the posterior portion of the brachial area or the arm, the antecubital, which is the elbow, the olecranon area, which is part of the posterior portion of the ulna, which we'll learn about when we talk about bones, and of course the posterior portion of the antebrachial area, which is the forearm, and then we have our carpal area within the upper limb, making up the wrist. Okay, and then again we have the posterior portions of the hand, and then posterior portions of the lower limb, including the coxal area or the hip, the femoral area of the lower limb region, being the thigh, the patellar area, as well as the popliteal area behind the knee, the curl area in the lower limb region making up the leg, the sural area, which is the calf, and then the fibular or peroneal. So this is actually the lateral portion of the leg, because we know that the fibula is a bone that's located in the lateral aspect of the leg. And then of course we have the different areas within the pedal region or the foot region that you guys can talk about, or that you guys can read about. So we have the tarsal area in the pedal region, which is the ankle, the calcaneal area, which provides points of attachments for the muscles within the sural or calf area. We have the metatarsals making up the bones of the foot, as well as the digital area that making up the bones of the toes, and then we have the plantar region making up the bottom of the foot, and then the hallux, which is actually the big toe area. So now we're going to describe the different body planes that we'll study, which basically body planes describe surfaces along which body or structures may be cut for anatomical study. So we have the three most common planes. We have the sagittal plane, the frontal, also known as the coronal plane, and then the transverse or horizontal plane, and we also use the term cross-section. Okay, so sections are cuts or sections that are made along a body plane. These sections are named after the plane that they are cut in. So, for example, a sagittal cut results in a sagittal section. The first body plane we'll talk about is the sagittal plane. So the sagittal plane will divide the body vertically into right and left parts. This produces a sagittal section if cut along this plane. Now we have specific types of sagittal planes. For example, the mid-sagittal or median plane will divide the body perfectly into equal right and left halves. Okay, so this cut was made perfectly on the midline. A perisagittal plane, however, this cut was actually made off-centered and not on midline, so you're not going to have equal right and left halves. However, it's still cut so that it divides the body into right and left. The frontal coronal plane will divide the body vertically into anterior and posterior parts, or front and back parts, which produces a frontal or coronal section. The transverse or horizontal plane will divide the body horizontally, so perpendicular to or 90 degrees to the long axis of the body, or to the vertical plane, and usually will divide the body into superior and inferior parts, or top and bottom, and this produces a cross section. So an example I like to give is, imagine a magician, you get volunteered to lie down and they cut you or saw you into half being a top and a bottom part. So that cut is being made in the transverse or horizontal plane. Now, an oblique section we don't often talk about, but basically an oblique section will result in a cut at an angle other than 90 degrees to a vertical plane. So here we see planes of the body with their corresponding MRI, or magnetic resonance imaging scan. So MRI is basically just a fancy imaging study that we use to look at the inside or internal environment of the body and the inside organs of the body. So here, this first example, we have the cut made in the median or mid-sagittal plane. Okay, so again, mid-sagittal plane dividing the body into equal right and left halves. So here we see the sagittal view made in an MRI. So we can see structures on the left side of the patient in that sagittal plane. The next is our frontal or coronal plane. We can see on the MRI a frontal or coronal cut or section showing us some of the inner organs within the thoracic cavity, as well as a little bit of the abdominal cavity as well. The next plane is a transverse plane, again making a transverse or horizontal cut that divides the body into top and bottom halves. And we can see that cross section here in the third MRI. This has been made within the abdomen because I can see some abdominal structures such as the liver, the pancreas, and even the spleen located more posteriorly, along with the vertebrae of the spinal cord, also located more posteriorly. So just again, another close-up of the mid-sagittal plane and the corresponding MRI, the frontal coronal plane, and the transverse plane. Next section we're going to talk about are body cavities and membranes. We know that the body contains internal cavities that are close to the environment. These cavities help provide some different degrees of protection to the organs contained within them. And we have two main sets of cavities. We have the dorsal body cavity. So we know from our previous slides, dorsal means towards the back or posterior. And then we also have our ventral body cavity, which is located more anteriorly or towards the front. The dorsal body cavity, in its function, is to protect the fragile structures within the nervous system. And we have two subdivisions within the dorsal body cavity. We have the cranial cavity. We talked about cranial meaning towards the head. So the cranial cavity encases and protects the brain. The vertebral cavity actually encases and protects the spinal cord. So here we see on the left a lateral view of the dorsal and ventral body cavities and their subdivisions. So within the dorsal body cavity, we have our cranial cavity containing the brain and our vertebral cavity that contains the spinal cord, okay, all located within the dorsal body cavity. It's nice this is color coded. We can see dorsal is in yellow, whereas the ventral body cavity is in this reddish orange color. And we'll talk about the different subdivisions within the ventral body cavity. So we actually have two subdivisions. We have the thoracic cavity here, containing the heart and lungs, and we have the abdominopelvic cavity here. So the made up of the two different cavities. We have the abdominal cavity that contains digestive organs. Guys, whenever you see the word viscera, viscera means organs. So viscera means of organs or pertaining to the organs. So abdominal cavity contains digestive viscera or digestive organs. Whereas here, the pelvic cavity contains urinary bladder, reproductive organs, as well as the rectum. So all these subdivisions contained within the ventral body cavity. So the ventral body cavity houses the internal organs, also known as viscera. The two subdivisions, which are separated by a very important muscle known as the diaphragm. The diaphragm is the muscle, it's also a muscle of respiration that will divide the thoracic cavity from the abdominopelvic cavity. The thoracic cavity is made up of two pleural cavities. Each of these pleural cavities surrounds one lung. We have the area known as the mediastinum that contains the pericardial cavity and surrounds other thoracic organs such as the esophagus as well as the trachea. The pericardial cavity is actually the cavity that will enclose and protect the heart. Now, the abdominopelvic cavity is actually made up of two subcavities. We have the abdominal cavity that contains a lot of our organs of digestion, such as the stomach, the intestines, spleen. That's more of the lymphatic or immune system, but still contained within the abdominal cavity, as well as an accessory digestive organ, that big organ known as the liver. The pelvic cavity contains the urinary bladder, as well as reproductive organs and the rectum. So we talked about homeostasis in part 1 of this chapter, and we have different organ systems that help maintain homeostasis within the body. So problems can occur when structures stray or invade neighboring cavities. For example, we have a condition known as a hiatal hernia. This occurs when part of the stomach actually will protrude through the diaphragm, that diaphragm being a muscle separating the thoracic and abdominal cavity. And it protrudes through the diaphragm into the thoracic cavity. Now, what can happen? This can actually push stomach acid back into the esophagus, causing irritation. This is commonly referred to as heartburn, also known as GERD, or gastroesophageal reflux disease. Severe cases may actually require surgical repair because we know acid is very caustic, and it actually can wear down the lining of the esophagus and cause a lot of damage. It can also cause cancer. So, hiatal hernias are not good clinically because, again, they can cause damage. We have membranes within the ventral body cavity. We have structures known as serosa, also called serous membranes. So serosa, these are thin double-layered membranes that cover the surfaces in the ventral body cavity. So imagine a balloon and then punching the balloon. We know that once you punch the balloon with your fist, we have an outer layer of the balloon, and then that your fist will not touch directly, and then we have an inner layer of the balloon. So I'm not an artist, guys, but imagine this is the balloon here that you punched with your fist. So again, imagine that this is your fist, blah, like so. Okay, so you have part of the balloon on the outside. This would be considered the parietal layer. In the case of the ventral body cavity, this would be the parietal serosa. This is the layer that will line internal body cavity walls. And then you have this layer that actually is adhered to or touches your actual fist. Imagine your fist being an organ within the ventral body cavity. So this layer that is touching your fist is known as the visceral serosa. The visceral serosa, so we know that visceral means pertaining to organs. This serosa is what covers internal organs or viscera. Okay, so that inner layer covering the fist, or your fist representing an organ, that is the visceral serosa or visceral layer. So there is space between the two layers. Okay, so double layers are separated by a cavity. Usually the cavity is very thin. It's slit-like, and it is normally filled with serous fluid. This allows for movement or sliding of the layers among one another so that organs can expand or contract. So this fluid is important to kind of create and allow these layers to kind of slide past one another. And this fluid is normally secreted by both layers of the membrane. Okay, so we have that cavity that contains serous fluid. So we have a name for specific cavity and organs so the serous membranes are named for the specific cavity and the organs that they are associated with. For example, the serosa or serous membrane that covers the heart is known as the pericardium. The serous membrane that covers the lungs is known as the pleura. And then within the abdominopelvic cavity, we have the serous membranes that surround the viscera within this cavity. This is known as the peritoneum. So again, an example of this, we look at the pericardium, that serous membrane that surrounds the heart. And here is that balloon example that I gave you earlier. This one is actually a better drawing than the one that I made. But again, same concept. So we have a balloon, you punch the balloon, and the outer balloon wall that isn't touching your fist, this is known as the parietal serosa. In the case of the pericardium, it is known as the parietal pericardium, that outer layer of that serous membrane. We have the inner layer, and in terms of the pericardium, the inner layer that actually touches or adheres to the heart itself, this is known as the visceral pericardium. Okay. And then we have the space between the two layers known as the pericardial space that, again, will contain some serous fluid. So another example of imbalance or homeostatic imbalance that can occur within serous membranes, we know that inflammation can occur as a result of infection of the serous membrane. So anything that ends in itis, for example, means inflammation of. An example of this, pericarditis. So pericarditis is inflammation of the serous membranes of the pericardium that surround the heart. If we have inflammation due to infection or other causes, normally smooth layers can become rough and even stick together. resulting in a lot of pain, in excruciating pain. Examples of this include pleurisy, which is an inflammation of the pleura, the serous membranes that surround the lungs, or peritonitis. Again, anything that ends in itis means infection or inflammation of, so this is inflammation of the serous membranes within the abdominopelvic cavity. Within the ventral body cavity, we can actually divide our abdominopelvic region into quadrants and regions. So quadrants, quad means four, means that we can divide the abdominopelvic area into four areas, so into quarters. So the abdominopelvic region is divided into four quadrants. We have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Now, why do we use quadrants and regions? Well, surgically speaking, if we are trying to locate an organ within the abdomen or within the abdominopelvic cavity or region, we use these terms to help us locate these organs. So for example, we know that if we take a look at this next diagram, we know that the appendix, that pesky vestigial organ that sometimes becomes inflamed and causes appendicitis, we know that it is most often located within the right lower quadrant. So when we perform surgery, this is the area that we go to try to find that pesky inflamed appendix during an appendicitis, so that we can perform an appendectomy, removal of that inflamed or infected appendix. So here we see the four abdominopelvic quadrants. Again, we have the right upper quadrant, and we can see different organs located in that quadrant. We have the right lobe of the liver, the gallbladder, parts of the large intestine, and a little bit of the small intestine, and then the distal portion of the stomach. In the left upper quadrant, we can see most of the body as well as the fundus of the stomach, the left lobe of the liver, even the spleen is located in the left upper quadrant, and then part of the transverse colon located in the left upper quadrant. And then in the left lower quadrant, we can see the distal portions of the large intestine as well as a lot of the small intestine located within this quadrant. With regards to regions, we have 9 abdominopelvic regions. These resemble a tic-tac-toe grid and are used primarily by anatomists as well as surgeons. So these are the 9 different regions. We have the right hypochondriac region, and then we have the epigastric region, and then the left hypochondriac region. Below that, we'll have the right lumbar region, the umbilical region, and then the left lumbar region. And then below that, we'll have the right iliac or inguinal region, the hypogastric region, and then the left iliac or inguinal region. So if we take a look at this diagram here, we can see the different abdominopelvic regions. Okay, so know that with regions, there are 9. With quadrants, as the name implies, there are 4. So you should be comfortable naming all 9 of the abdominopelvic regions as well as 4 of the different quadrants. And then if you take a look at this diagram below the picture, you can see the different specific organs located within each region. So we do have other body cavities besides the 2 main body cavities. We have several smaller cavities that are exposed to the environment. For example, we have the oral and digestive cavities. We have the nasal cavity. We have the orbital cavities that contain our eyeballs. We have the middle ear cavities. And then we have a cavity not exposed to the environment. We have our synovial cavities. These are cavities that are specific joint cavities that we'll talk about when we go over joints. All right, everyone, that was part 2 of chapter 1 of our lecture video series. Hope you guys enjoyed that. And yeah, that is it for chapter 1.